Hi, I'm Dr. Allen. I'm a GP from Burley Health Centre. Just a quick video update around hay fever, just because I think it's going to be quite bad over the next few days, and it's just helpful to have a bit of extra information perhaps about how to prepare, what things you can do. So it's also called, it's also a form of allergic rhinitis. Just sometimes it can be helpful to have the extra terms, and it's an allergy to grass, trees and weeds, and it's the pollen that comes from them, and their pollen comes at different times of the year, which is why some people suffer more at different times of the year, depending on what your allergy is. The typical symptoms of hay fever might be sneezing, nasal discharge, congestion. It can affect the eyes, make them itchy and red. So some things that you can do are trying to avoid times when the pollen is high, so keep an eye online looking at when the pollen count is likely to be high. Avoid going out in early morning or early evening, or when the grass is being cut. Avoid drying your clothes outdoors on high pollen count days, and keeping the windows shut and showering more often on those days. In terms of what things you can do to help, so nasal irrigation with saline is something which is the NHS suggests can be really helpful, kind of washing out the pollen, perhaps is how that works. And then in terms of what things you can take, antihistamines. Well, if you go to your pharmacy and there's so many things that you can get for it, and they have them at the pharmacy, so you can ask them. The only tip I would add is just to kind of, rather than working through brands, really think about what the active ingredient is. So the main active ingredients you'll find are things like antihistamine, and so try the different forms of antihistamine. There's also something called sodium chromoglycate, and there's steroids, which can be a nasal spray. Ask your pharmacy for help and work through the different options, but based on the active ingredients. And in terms of kind of getting extra information, because it really helps if you know more, you can manage these kind of things better, and that can help you to get on in life. So places you can get extra information will be Allergy UK. NHS Online has got excellent information for hay fever, and patient.co.uk are all excellent places you can get some extra information. So I hope this has been helpful, give you a little few tips that might help you to kind of get through the difficult hay fever seasons. All right, thanks, bye.